Okay, this is a rubber tip stimulator. Now, as a kid, we had these on our toothbrushes all the time, and I never really knew what to do with it other than just chew on it. But there is some benefit here, and especially if you have already have gum disease, we may ask you to use the rubber tip stimulator. And the idea with the rubber tip stimulator is just to go in between the teeth, and you're gonna push, and you're gonna just kind of push it in between the teeth, and it'll cause the tissue to blanch, and you'll just count to 10. Let that pressure just turn the tissue white, and then you're gonna go up, and wherever that fits in good, you're just gonna put the squeeze on that tissue, and let the tissue blanch. And what'll happen is it just takes some of the puffiness in the gum, and it presses some of the fluid that's in the tissue out, and the tissue tends to tighten up. And so that's the idea, is wherever you go, wherever it fits, just give a good push, count to 10, and then go up a tooth and go right on around where, especially in those areas where the gums have that puffiness, when you have the pockets, that helps to get rid of some of that inflammatory fluid, and that'll help to tighten the pockets up. The problem with the pockets are, even if you're the best brusher in the world, they protect the bacteria, and you can't get in to clean where you have those deep pockets. And so the more we get the gums to tighten up, the more you stimulate them. As you brush, as you do all of this, the gums tend to tighten up. Sometimes people will back off because, well, their gums bleed, they hurt, and so they think they're doing too much. And usually it's a matter of them not stimulating the gums enough to get them to tighten up. And that's my talk for the rubber tip stimulator.